Health Minister Dr Joe Phaahla has reiterated the message of local scientists that we should not panic over the new COVID-19 Omicron sub-variant and that there's no need to bring back any COVID-19 restrictions. But Dr Joe Phaahla says anyone who wants to get a booster vaccine jab should do so, especially those with comorbidities. South Africa currently has one confirmed case of the XBB.1.5 sub-variant, and local epidemiologists say it's unlikely that we'll see high infection and hospitalization numbers that other countries are experiencing. For more on this, I'm now joined by the Health Minister. Thank you so much for your time, Dr. Joe Phaahla. We do appreciate it. I think there's been so much panic around this new variant. We've been seeing what's happening in countries like China. Perhaps just allay the country's fears, if there are any fears, about this subvariant and that there is no need to panic.
Well, thank you very much, and evening to your viewers. Indeed, our message is that we've been on this path before. Just over a year ago, at the end of 2021, to be exact, around 23rd, 24th November, it was the first time that our scientists brought to our attention the advent of the Omicron variant of the coronavirus and COVID-19 coronavirus. Now, since that time, there has been several mutations of this Omicron variant. It has spread to all over. In fact, has become, for most of 2022, was the dominant variant of the COVID-19, although it with several mutations but remaining the same, what is called the variant of concern. So this detection now in the laboratory through our sequencing laboratories of the existence of the XBB.1.5 subvariant of the Omicron comes on the heels of other subvariants, including those which are dominating even in the People's Republic of China. So the reason why we're saying that we think at this stage, we agree with the advice which we have been given by our own local scientists, including from the Ministerial Advisory Committee, but also from the World Health Organization, is because of the fact that this is just a sub-lineage or sub-variant of the Omicron, and over the period, while there's been all these changes, they have proven not to be very different in terms of severity of disease and also response in terms of the immunity instilled by vaccination and also from the natural immunity. So while we are monitoring the situation, we want to do a lot more testing, but at this stage we are satisfied that there is no immediate fear, immediate danger for us to can even consider serious measures of restrictions.
Well, we hope that history doesn't repeat itself, Minister, because if I remember correctly, in January 2020, we were also told not to panic, and then the country went into full lockdown not even a month or so later. But that is not on the radar of the NCCC, is it? You are not looking at imposing any restrictions or mask wearing or any of that sort at this stage, are you?
Definitely not. We did brief the National Coronavirus Council this morning on our own request, after the President also had raised the matter to say where do we think we are, and we then requested that if we can have an opportunity. He did so. We convened the Coronavirus Council, and after the briefing, there was a unanimous agreement that with the experience we have now and with the information at our disposal and experience, not just in our country, but throughout the world, we have got no reason really to consider at this stage any reinstatement of previous restrictions, or even further down the path, it's a possibility of a lockdown. That is just out of the consideration at this stage. We believe that we should reinforce the tried and tested measures in terms of making sure that we continue to do testing, all that we have requested from our partners in the provinces and also in the laboratories, both in terms of the public laboratories and private laboratories and the practitioners, is to have a higher index of suspicion and do more testing, and also to make sure that any test which turns positive, as much as it's possible, as the capacity of our laboratories and the sequencing laboratories especially, we should do more sequencing of the positive tests so that we can be able to detect if there's any significant variance at this stage. But at this stage, and of course, the top message is really for all of us to continue to vaccinate and get the boosters whenever we actually qualify for those.
Let's quickly speak about vaccine availability. I'm sure you have an oversupply, and it's so unfortunate, Minister, because I remember in the peak of the pandemic, South Africans were so desperate to get vaccinated, and the country, of course, couldn't get its hands on vaccines as quickly as possible. But what is the vaccine availability at this stage, and possibly also vaccine wastage? Because I know that a lot of the vaccines could be expiring, especially because there's been a low uptake of these vaccines.
At this stage, where we are is that, remember that in the early period of 2021, when we started the vaccination program, we had some difficulty in accessing Johnson & Johnson for various reasons. We started with it in terms of the Sisonke, vaccination of health workers and also with the teachers. But then when we wanted to roll out, there were problems at their main plant in the US. There were a number of issues, including having to wait a little bit with the issue of the clotting. So we delayed receiving a big amounts of doses of Johnson & Johnson. And we then were able to access the Pfizer. So we rolled out, in terms of the measure rollout, significant amounts of Pfizer doses and then a little bit of the Johnson & Johnson. So where we are now is that we still have about 8 million doses of the Pfizer, which is the vaccine which we have used the majority out of the about 30 million doses which we had access to. So we are left with about just over 8 million currently. Because of the capacity of our storage in terms of, the Pfizer requires upwards of 72 degrees centigrade, minus 70 degrees centigrade in refrigeration. We do have a good capacity in that regard. So those vaccines have been tested by SAPRA. They are found to be very stable, and therefore they were able to extend further their viability. So at this stage, the vaccines we have of Pfizer will expire between March and April this year. There is a possibility that if they're still very stable, they could have a little bit more further extension, which might be the last extension if they are still stable. And then on the J&J side, we have another 10 million doses in our storage, which, there's still uptake, there's still people coming forward, new vaccines, but also a number of boosters. There are still people coming through. The numbers are small at this stage, but we're hoping that with this message of the fact that it again a reminder that COVID is not over, those doses can still be utilized. And we really urge people to come forward and take up those boosters, and also those who have not been vaccinated to come forward.
Okay, Minister, I just want to shift gears for a second and speak about the Boksburg gas tanker explosion and what's happened at the Tambo Memorial Hospital, where 12 healthcare workers have lost their lives. I'm going to ask you two questions in one. Today, DENOSA, the nursing union, stood up and said that the healthcare workers that lost their lives died with broken hearts because they work in very difficult conditions, and they also they are underpaid, they work very long hours, most of them are blacklisted. And you as the minister, I'm sure you're aware of these challenges, because this is not just a Gauteng problem, this is a national problem. As a minister, what are you going to do about this to better the lives of those that are there to, basically look after the sick and the most vulnerable in our society? And also, how are you going to make sure that the revamping and the refurbishment of this hospital is done in a proper manner and there is no corruption or looting involved?
Well, first, let me again, on behalf of on my own behalf, of the department and ministry and the government as a whole, again pass our sincere condolences at this tragedy, as who also lost their lives in the very tragic circumstances. Nobody should really be subjected to that kind of end of life. Very traumatic, very painful, and it shouldn't happen to anybody. In terms of the working conditions, indeed, we want to say that we want to do everything possible to improve the conditions of service of our health workers, both in terms of the pressure of work, the shortage of staff, which leads to long hours. We have tabled this at various forums of government with the Ministry of Finance. I've had a number of discussions, with the minister himself, Minister Godongwana, but also collectively at cabinet levels. And there's a lot of sympathy and a lot of support for us to receive more resources so that we can, on one hand, employ more staff, so that the pressure of work can be less severe, more manageable, so that the working hours can be much more comfortable. Secondly, also in terms of the remuneration of staff, these are matters which we're looking at. But of course, we have to work within what is available within the fiscus. Unfortunately, all of us depend on what is collected by revenue services and distributed by the National Treasury. We know that there are a lot of needs in the country because of the pressure also of loss of jobs, some of it as a result of the COVID pandemic. We brought in the social relief of distress, as small as it is, the 350, but being able to alleviate extreme poverty, reaching up to 10 million individuals. And those kind of considerations of balancing of alleviation of poverty and also making sure that other services can be sustained. That's the balance, unfortunately, of what leadership is all about. But we're hoping that as things stabilize, as the economy stabilize and improves in its performance, more revenue can be collected and we can be allocated more resources so that we can employ more staff, but also in terms of improving what is available as a remuneration for our staff, both as basic salary and also in terms of other, other services, other rights, such as in terms of overtime and so on. So we don't disagree with Dinosa in terms of the fact that we need to do more, but of course we are really at the mercy of how much resources are available so that we can be able to improve the conditions.
Sure, yeah, I hope that is definitely a consideration, Minister, because nobody should be living a life like that, especially healthcare workers who basically risk their lives every day. So we'll definitely be following up on all those factors. Thank you so much for your time this evening. We do appreciate it. That was Health Minister Dr. Joe Phaahla.